Right set of glasses on. Okay, first thing on the agenda is minutes from previous meeting. Everybody received those minutes a week or so ago. I saw no corrections. Anybody have any corrections, deletions, or additions? Can I have a motion to approve, please?
I'll make the
Thank
motion
you.
to approve those.
Thank you. And a second. And all those in favor of accepting as written, please say aye. Aye.
Aye.
Next on the thing, Bo Payne's report. Mr. Payne.
Yeah, I don't really have anything for you guys because it's the middle of summer. Other than we're approaching budget season, right? So I got the first shot across my bow to start looking at budgets. So I'm sharing that shot across your bow.
Okay.
If you guys have anything in particular that you feel needs to be looked at, considered, amended, adapted, added, removed from the deer and tick budget, get with me in the next 2 weeks or so, or shoot me an email, give me a call, and we'll talk about it. I don't.
Maybe, Bo, you and I should
Too
sit
much.
down and I can, because it's nice for me to look at what last year looked like.
Yep.
And see, and anybody has anything they want to add to it or talk about, talk to Bo or myself,
Yep.
and we'll try to work something out. We'll get back to you on that.
That's it.
Okay, well, that was pretty easy. Next is educational report. Julia.
I don't have anything right now because we just wrapped everything up there at that last meeting. Was really haven't done anything else since.
Sounds good. How is the, what do you call it, the archery program going?
Oh, it's going great. We're in the last month. I might reach out to the reporter to put something in. So we're going to have a archery tournament, which is for the final round of these kids on the last Saturday of August. And I might invite the public because we have had some parents come, and it kind of adds to the excitement. Kids like when there's bystanders watching the tournament. So I may do that and see if we can get some more people to come down. I also invite the council people who are, part of our committee if they want to come watch. It's really fun. That's all going good. And then I'm trying to think what else. There is, I don't know if maybe Bo can put this out to some of the hunters. So they're on August 18th at Suffolk Archers, which is normally a private club. It's usually closed to only members, but we are having like a big seminar that day. It's from 8 to 2, and it is open to all hunters. You don't have to be a member of Suffolk Archers to attend. And I'm actually teaching a seminar on dog tracking with Lee Behrens. And there's going to be all kinds of stuff there, stuff about, making bows and arrows, butchering. There's going to be all kinds of seminars all day, and it's from 8 to 2. And Suffolk Archers is up in Huntington Station. So I can send Bo that information if you want to just pass it on to people that might be interested to go. And there's food, and it's a nice afternoon with other people. So
Right. Julia, if you can get that information to Bo,
Yeah.
he does have a list of emails, I believe,
Yeah,
from many of our
I'll send it out.
archers. He could get it out there, so it might be interesting for them.
Yeah.
Okay,
and then we just have the Green Expo coming up, which I just
right, and I was just gonna bring that forward too. The Green Expo's coming up. I went
Yeah.
online today looking at, see if I could confirm the dates, which I couldn't get anything from the, what do you call it, the town email wasn't coming through. So when is that date? Does anybody have it? I know it's at the end of August.
But I just
Usually
want to let you know, Doc, that I did look in my garage, and I apparently took home all the pamphlets from our table. So I have all that stuff with
And
me.
do you think we have enough? Do we have enough is the question?
There's a lot. There's a lot in
Okay.
there. Unless Scott tells me it's changed. I mean, it's only a year old. I think those pamphlets would be fine, right?
Right. Yes, they'll be fine.
I would
All
assume
right.
that I don't think there's anything date critical.
Yeah. Okay.
Right. Okay.
If it's the same day as the art craft fair,
It
which I
is.
think it usually is the 24th.
24th, that's what I thought.
It is. Yeah. Okay. This is
It's
fine.
the 24th. Starts, I believe, at 10 o'clock to 2 or something.
Julia, when's that archery tournament you mentioned?
Wait, sorry, who said that?
Benjamin.
That's
Oh,
been, Diane.
it's gonna be the last Saturday of the month, so weather permitting, I don't know, I think that's like the 24th, maybe, 24th?
Same day as the Green Expo?
Yeah, but we teach in the morning, so we're from 9 to 10 and then 10 to 11. There's two classes back to
The
back.
last Saturday of the month is the 31st.
Okay.
No, so we're not teaching that. The class runs, I think, whatever that Saturday before that is.
That's Green Expo.
It's the same day, is the same day as the Green
Could be.
Expo?
Gonna be a busy day.
Yeah, the Green
Ah.
Expo is the 24th, as is the art fair.
Yeah, I
Okay.
guess it is.
So we'll have a little conflict. I'll hold down the fort while you're teaching the archery.
Well, wait,
course, so
doesn't it start, I thought that I thought we start at like 11 or something, right?
We might start at 11. I thought it was 10 to 2, but it might be 11 to 3
All
or
right,
something
so I
like
might
that.
be like just a
Whatever.
little late getting there, but
It's not that important. I've responded that we would be there, Julia, you and I probably.
Yeah.
Okay. Just on education, and this is to Scott, I was hoping Josh was here, Dr. Potter, who was supposed to be on his way or said he might be a little bit late. Is there any definitive recommendation from CDC or Department of Public Health on what people should do when they find a tick embedded on them? I get that call all the time. Should I save the tick? Should I send it someplace? Should I go to my doctor? And I'm dealing with maybe a little bit of the old school, but I try to see if they can tell if it's a deer tick versus a Lone Star tick and how long it's been on there. Less than 36 hours, probably don't have to do anything. Otherwise, they may need to get the, a prophylactic dose of doxycycline. Scott, is there anything that's definitive out there, not to get, that we have to put it out, but that we can refer people to as far as what to do? Oh, here's Josh too. What to do when they find a tick embedded on them?
Yeah, so CDC, all websites will tell you to remove the tick as quickly as possible. Obviously,
Right.
you don't want the tick on you. The minute you find it, it should be removed with fine pointed tweezers, and the tick should be kept. It can be placed in alcohol, hand sanitizer, or rubbing alcohol, hand sanitizer, or taped to a card, index card. If it's in a vial, the vial should be labeled with the date and the location where you found the tick attached, or it can be written on the card if you tape the card. There is mention on CDC to flush it down the toilet. I don't know why. That's most groups will tell you to keep it, but some people want to get rid of it. I guess flushing it down the toilet is better than throwing it in the garbage and having it come back out of the garbage can into the house. I guess they don't really explain why to flush it, but that's the only thing I can think of, because some people just don't want the tick around. You don't squash it, you don't cut it, you don't open up the contents of the tick. Some people like that vengeance, but again, you're exposing those around with all the infectious agents that might be in the gut. And then CDC does not recommend testing the tick for pathogens. And their thinking is this: if that tick is found positive, did it feed long enough to transmit the pathogen that is in the tick? So there's a window for all the different pathogens. For example, the spirochete that causes Lyme disease is about 36 hours. So if you take the tick off in 12 hours and it's positive for Lyme disease, now you're fearful that you were infected, and that may cause a certain trajectory of treatment or fear or whatever. Or let's say you take it off and it was negative. Now you're calm. It's like, okay, but you actually didn't find the second tick that fed to repletion that infected you with Lyme, with the agent for Lyme disease. So CDC recommends not testing the tick and just looking at symptoms. A rash at the bite site, how you feel. So that's the general thinking of that and testing of ticks. People do test ticks, but they have to kind of realize that the result has parameters that need to be evaluated, and most people don't really think along those lines. And there is a PDF on the CDC website that outlines that whole scenario. But most websites, including ours, recommends quick removal and keeping the tick so it's available should the medical community or medical care provider want to see it, want to know what kind of tick it is. We do tick IDs. There are other locations that just do tick IDs, and that is actually beneficial because now you know what bit you. So it can kind of narrow down the possible pathogens that may or may not have been transmitted.
Also last year on our social media campaign, I forget what, when we did it exactly, but we shared a website where people could, like Scott said, they could take a picture of a tick and you can send it in, it's free, and they'll tell you what kind of tick it was. So we did that. And then the little cards, if you gentlemen remember the cards that we gave out, they were like tiny cards at the Green Expo last year. Those were really nice. They had like exact sizes of ticks, like life size sizes, so you could judge what it was. And then I believe on that card, it tells you what to do, like recommended strategies to find a tick. So those are ones that we gave out because they were very convenient because they could fold and put in your wallet.
Yeah, the tick ID cards, and I believe they came from the Tick-Borne Disease Resource Center of Southampton Hospital. Did we get materials from them for this
I
year?
have them. That's in the garage too.
We have those and handing it up. My real question boils back down to, when do they contact their physician? Okay, Josh, what I was asking is there a definitive, plan for people that find a tick embedded on them? Okay, when do they contact the physician? Do they wait for symptoms? Do they contact as soon as they find it in order to get a prophylactic dose, or what? And I'm not sure that everybody has the same opinion of that. So,
I think you're correct that everybody does not have the same opinion of that. The general advice, I could tell you what I would recommend based on the CDC, on my interpretation of the CDC and Infectious Disease Society of America's guidelines are, so like Scott was saying, for transmission of the various pathogens and the ticks that we have, most of the things take a little bit of time. So Lyme disease, the earliest is probably around 36 hours. It's still pretty uncommon, up to about the 48 to 72 hour window in most studies. But the cutoff mark for consideration of prophylactic antibiotics to try to lower the risk of Lyme disease is that 36 hour mark. If it has been attached longer than that, the problem is people very rarely can quantify exactly how long it's been attached. So we try to use whether it's engorged or not with blood as a proxy, or a rough idea of exposure. So on the Lyme side, what I'll tell people is, definitely call if you find a tick and are confident it's been on there for several days. For example, if you say they went out hiking on a Sunday and they call the office on Wednesday, and that's the only confident period of exposure they've had, or it's big and fat and engorged, then definitely call and we discuss prophylactic doxycycline to lower the risk of Lyme. Lowers it, it doesn't take it away completely. Lyme is the only tick-borne illness that there's prophylactic evidence for. So anaplasmosis or ehrlichiosis, babesiosis, there's no evidence or guidelines to suggest that taking a prophylactic dose lowers that risk, or at least no clear guidelines right now that I know of. So in general, but because there is so much co-infection across those different illnesses, in general, I'll say my advice is to check daily, check frequently, try to avoid exposure as you can, wear your socks high, tuck your pants in, use repellent spray, etc. Anything you find, like Scott was saying, take off right away. And anything you think may have been on for longer, call to discuss or come in for an appointment to discuss. Because our tick burden is so high and there are so many frequent bites that people will describe. Then the other thing I think is very prudent, particularly during the height of tick season, is just to sort of generally have a talk and say, go to the CDC's website, the resource center at Southampton Hospital, review what the various symptoms could look like. And in general, I'm saying, I would call if at any point you're feeling symptoms like this, particularly if you had a preceding tick bite that you think may be related to it, to at least discuss and see if it's worth going through. That's my advice for when to reach out and touch base with the office. I think that's pretty consistent with the best evidence that we have. Does that make sense?
Yes, no, it makes perfect sense. I'm just looking, as I said, I get multiple calls, but I'm sure you get some too. Person comes, finds a tick spin on him, just came back, been on Shelter Island for a day, was in Mashamek, and it's been on there for 12 hours.
Yeah.
Okay.
He's got a tick since he's been here.
Right.
No problem. And I mean, and that's why,
And then the question is, are you getting a lot of calls, that probably are, you're fine, don't worry about it? And is there any way to alleviate some of that, or do you just expect those calls?
the answer is both.
Yeah.
The way to alleviate that is continuing education, like Julia's doing and the Suffolk County does and the hospital does, the resource center.
Right.
I do spend a lot of time and a lot of visits focusing on education. We have informational material in the office that we try to provide. A good bit of that being reassurance, right? If the
Right.
tick is on for a brief period of time, 12 hours less a single day, the likelihood of transmission for Lyme, for example, is low if it exists at all. Other things can transmit more rapidly, but fortunately, there is much lower prevalence, right, of things like Powassan, et cetera. So the answer is both. I try to say, look, if it's you're out hiking and you get back and you find one, take it off right away. Your risk is pretty minimal. Still try to identify it, whether you hold on to it or you have a tick identification card, or you go to what was it? I'm sure Scott will know. Was it University of Rhode Island who has that really great tick identification webpage? I
Tick
used to.
Encounter.
Yeah,
Tick
tickencounter.org, that's it. And, keep that information down, and if you think you have anything related, give us a call. But the true answer is always going to be both, because, a not insignificant amount of the time, people who develop Lyme disease have no recall of a tick bite, right?
The majority of the time, if not.
Yeah. So a lot of it is planning and expecting. We get very frequent phone calls. We have a sort of triage process for discussing that. And that is, I think, sort of a best practice to either have information that clearly states, if it's a brief period of time, you're fine, keep clean, keep an eye on the site, and monitor for symptoms always. And then if someone meets the prophylactic criteria, they either come in for a visit or we do a talk over the phone and
Okay, well, it looks like we're doing about what we can do, since we have multiple sites on our website, actually multiple spots for them to go, education, we keep trying to do. So we can, if, Scott, you and Josh want to make sure that there's nothing we're missing on our website for the educational portion of it, that would be good. Or if you know of something that's a little bit more definitive, a little better, or easier to read maybe than the CDC sometimes, for the public, the general public to look at. And again, I think, it's inevitably going to be, people are afraid of it, they're going to call you, you're going to get all those calls. I'm just trying to slow them down a little bit if we could, if education was be helpful, but I'm not sure it's going to do much good.
I think it moves the needle a little bit, and that's all we can keep doing is more and more educational efforts and reassurance combined with appropriate vigilance.
Okay, very good, Julia, thank you. Anything else, questions for Julia on education?
I'd like to just add that another reason to keep a tick is that it shows you the level of engorgement. So a tick that is just recently attached is flat, obviously, and one that has fed gets larger and larger. I've had people bring me a tick and they'll be like, oh yeah, I picked it up, last week at Mashomic. And so it's been attached for 7 days. And I'll say, well, this is a nymphal tick. It's flat and they feed for 3 days. So you didn't pick it up 7 days ago. So you must have picked it up at another time and it doesn't appear like it fed. So that's another advantage to keep it. And when you do a tick ID, and when you have it ID'd at my lab or elsewhere, they'll actually measure or indicate the level of engorgement. So that's another reason to keep the tick. It kind of gives you an idea of how long it's been attached, because people don't know. I mean, they're like, oh yeah, I was gardening yesterday, and that's where they think they got it, but you don't know.
Sure.
But really what it comes down to is that level of engorgement and how long it's been feeding. So that's another reason to keep the tick as opposed to get rid of it.
But Scott, a patient or a person comes in, ticking a tick embedded on them, they take it off. No symptoms. Should they just keep the tick and stop there? Or should they go on to have that tick examined, identified, engorged or not? Is it worth it to do that without having any symptoms?
Well, again,
It's
it's a conversation I guess you can have with your healthcare provider, but CDC recommends, looking for symptoms. All these are diseases. So you're going to have symptoms. You're going to see signs of infection. We have to remember that all ticks, even if they're infected, the infection rate for an area is not 100%. So there is, and rarely is it super, super high. So the odds are in our favor of picking up a tick that's not infected. Doesn't mean we can't, but the odds are in our favor. So, you just have to kind of keep that in mind. And obviously, the more we educate, the more people realize what the risks are. And ultimately, it's a discussion that they need to have with their healthcare provider.
Agreed.
Okay.
Can I ask a question on that?
Sure.
What are the symptoms that you may exhibit?
Well, I'll pass that to Dr. Potter, but
Not just the prevention or how to do it, but what are the symptoms that maybe would be concerning? Look out.
It's a great question. It varies a little bit among the various illnesses, but in general, because there is some overlap. I mean, the obvious one that we spend a lot of time talking about is the rash associated with early localized Lyme, right? Erythema migrans that often describe bullseye rash, which I spent a lot of time describing and explaining does not always look like that classic bullseye. There's a lot of variation described clinically in whether that has the central clearing to look like a bullseye, if it's just spreading redness. But as a general rule, I'll tell anyone, if you see redness starting at the site of a tick bite and that starts to spread, whether it clears centrally or not, that's a symptom to call about. Some are more prone to have fevers in early stages of illness than not. So babesiosis, the most salient feature is a fever early on. Anaplasmosis or lichiosis vary with how definitively you'll see a fever. Early Lyme does not always have fevers, but most of them will have new fatigue, malaise, sometimes muscle aches, joint aches. And then particularly with Lyme, it depends on what stage you're in, whether it's early versus late Lyme. The further you go into it, the more likelihood there is to have varying degrees of organ involvement, like Lyme carditis, where it can affect the heart, or neurological symptoms. So as a general rule, to keep from having to either spend 20 minutes talking about each one, I'll say if you see a rash at the site or new fevers, severe fatigue, muscle aches, joint pains, in general, those are the point to reach out and discuss it. Part of the greatest challenge and fun of the last 4 years have been what I would call is this Lyme, is this COVID, is this something else? Because there are or some other viral illness, all of which have non-specific systemic symptoms there at the beginning. But any new rash at the site of illness, or I'm sorry, at the site of the bite, any new significant fevers that there isn't another good explanation for, like someone's had pneumonia or something else, severe fatigue, muscle aches, joint pains. It's generally the point to reach out. At that point, though, it's trying to pin, is this, or is this any of the other variable infectious things that we're fighting and looking for right now?
Thanks.
Josh, question, more medical. Patient has a tick bite, and, well, maybe even doesn't have a tick bite, but is in an endemic area, comes in with those flu-like type symptoms and stuff. Do you always get a titer before you start treating? Or do you treat and then get a titer, or what?
It depends on the severity of illness and not to get too much in the weeds, but the pretest probability that I have that it is very likely. What's complicating to a degree is and how each testing process works, right? So Lyme, we're looking for an antibody titer. Anaplasmosis or ehrlichiosis are for the most part titers or specific increases in titers. Babesiosis is a little more variable because you can see a PCR, and you can see PCR for all of them, but that PCR may only be, which is the DNA of the organism itself, may only be briefly positive in the first couple of weeks. But clinically significant babesiosis also has other lab tests that will get back much faster, like a direct analysis of smear, than those antibody titers. So the CDC's guidance and the Infectious Disease Society's guidance varies a little bit. So if someone comes in and they have symptoms that are consistent with HMA or HME, anaplasmosis or ehrlichiosis, the recommendation actually is not to wait for your test results if you have a high clinical index of suspicion, because they can have significant morbidity associated. So, and both, with the early local Lyme, the morbidity with early Lyme in general is fairly low. So in theory, you have time, but that's not always the case. And it's sometimes difficult to parse out based on symptoms or what stage of Lyme disease someone's in. So if your index of suspicion is high enough, then we'll sort of prophylactically start doxycycline while we're waiting for titers or the other things to come back. It's pretty rare that I have to prophylactically start someone on and that's important because doxy treats Lyme, anaplasmosis, or ehrlichiosis. It doesn't treat babesiosis, so I always tell people, if it were this is not covering you for that. So there's advice, if you feel worse, call me or go to the emergency department. But I can get turnaround on blood work looking for the most important aspects of babesiosis, right? If someone's going to be clinically ill enough to warrant treatment, then they should have a high parasite load, and we get that back within 12 hours.
Okay.
So it's sensible to wait on treating for that until I get that data. So again, it's kind of a non-specific answer, but it varies depending on your level of suspicion. In general, I think it's reasonable to err on the side of caution if you have you're in this endemic area, it's the height of season and exposure. Most people and most evidence points towards go ahead and starting something empirically while you're waiting for definitive answers. And remembering too that titers are looking for antibody response, and that can lag behind exposure and the development of symptoms. So it's not always a definitive answer. If it's someone's coming in for pretty vague symptoms that they may have another very good reason for, it's pretty reasonable to wait for the results of your testing.
Okay, good. And the reason I ask is at one point, and this is going back a bunch of years ago, people were treating empirically a lot, and CDC came out with a study, I think, or at least a statement showing that most young people have lethargy and thing, and most old people have aches and pains and muscle joints and
Exactly.
pain. And if you look up even overtreatment for Lyme disease, and it was mostly about Lyme that clearly 50% of the people were being treated for Lyme didn't have Lyme
Right.
at one point. Now, this has probably changed over the last couple of years. But
No, and that's a much less jargony way of saying what I was trying to say, which is exactly that. I mean, if a 21-year-old comes in with severe fatigue, aches, and feeling crummy, then particularly now, my question is, and I taught on this with some residents within the last couple of weeks and medical students, is this Lyme disease? Is this COVID? Is this mono? Is this,
Right.
And a lot of that just has to be a case-by-case decision based on what your local prevalence of all those things are and how likely it is that it's one thing or the other. But I think there is a lot of overtreatment without definitive diagnosis, and that comes back to the education part. How many, there's very, very frequently people in the hospital or the clinic will say, I have a history of Lyme disease, and parsing out were they treated empirically, 10 years ago, 20 years ago, without a definitive diagnosis, how much this affects our epidemiological understanding of how prevalent it really is, compared to tick studies and site-by-site studies. It's complicated.
Right. I'm sure if you asked the general public if you had Lyme disease, if they were treated prophylactically,
Yeah.
many of them will say yes,
Well,
because they had the tick, they got the 2 doses or dose of doxycycline.
right. And so there's,
A year or 3 later, they just think, yeah, I had Lyme disease, I was treated for it.
we've said it before, but I think the educational aspects that this committee tries to do and that Scott and the Department of Health try to do, and the Tick-Borne Resource Center are the most important things that we can do.
Good. Okay, took that a little further than I really wanted to, but we'll move on. So next on the agenda is, so we just included that Green Expo in the educational portion. And then incidents of tick-borne disease. Scott had presented us with the newest data. And Scott, I think that was from Suffolk County, not state of New York, right? From last month. And it's starting as of 2022. Yeah, 2022. They're doing a new technique, and Scott could explain it better, but it just shows a significant, I won't say a significant increase in Lyme disease or babesiosis, just a different way of measuring it or of identifying it. So we're going to, from the future, just start at 2022, and we'll consider that as our starting point, as opposed to going backwards. Now, for 2022, let me just see, for Lyme, yeah, it looked like Shelter Island had reported 28 cases, and 2023, 30 cases. Scott, how does Suffolk County get those numbers?
So we get them from the state because since
Okay, so it
all
is the state.
tick-borne, yeah, since all the tick-borne illnesses are reportable to the state, they actually put them in their system. We have access to that system. So that's where I got those numbers from.
Right, now, does that rely on the physician to report them, or does it come from the labs? Or,
Well, and so this is the change starting in 2022. So it's any positive lab test for Lyme disease. So I believe it's the lab that is reporting. Maybe Josh knows if there's some, if it's lost, that it then goes to the physician to make sure that it's reported. But I believe it's now the lab that will do all the reporting. So it kind of takes that job off of the healthcare provider.
right,
Is that,
okay, and-
is that correct, Josh?
That is correct to the best of my knowledge. I don't believe, so if I do labs on a patient and there's a positive babesiosis or anaplasmosis, then I get contacted by the county to provide more clinical information.
Right.
It does not happen for Lyme positivity for a variety of reasons, as you know, right? But I am not, we do not have to, it's not like I don't know.
It's not like a communicable disease
Yeah,
that
it's
you
not
have.
like if someone came in with dengue and I had
Right.
to immediately report that. I
So,
believe the labs are providing that information to the
Right,
state as
so
far
the
as
health-
I'm aware.
so prior to 2022, the health department had to investigate cases
Right.
of Lyme disease. So like we're doing for babesiosis, anaplasmosis, ehrlichiosis, et cetera, talking about spotted
Yeah.
fever. So we don't need to do that anymore, and that's why there are no calls coming regarding Lyme cases, but there still will be investigations on the other ones. So it's just the labs that are reporting their positive results to the state, and then we're able, being part of the health department, able to access those numbers. And that's where I got those numbers from.
Okay. Does the county or state have a feel for how accurate they are? And I refer to back a bunch of years ago, the CDC put out a statement that Lyme disease may be underreported by as much as 10x. And I don't know if that still holds true, or does the state or county feel that these are accurate numbers for Shelter
Well,
Island?
I think the jury is still out, but I think that CDC made this change because they feel there'll be a better reporting and a more accurate indication of Lyme disease. I mean, again, some people could come in with an erythema migrans, no blood is taken, they
Right.
obviously are a case, they're treated. That
Right.
case actually, that has to be reported to the state. So that there's no way that the lab is going to know that. So it's up actually, it's up to the physician to report, or the healthcare provider to report that case if it's a treated erythema migrans case.
Okay.
So if that's not reported, you're going to see that not reported accurately. So I think it's going to be better. And I think time will tell. The more years we have past 2022, we'll be able to look better at the numbers. And I think that if I had a crystal ball, I would bet that we'll have better numbers for Shelter Island. We'll have better numbers for Suffolk County, New York State, and nationally. We're definitely going to have more because there are the numbers jumped significantly in 2022 compared to 2021. So we will have
Clearly
numbers,
there's
and
an
that's a good
increase
thing.
there. I just was wondering what the feeling was there. So these numbers are probably still, to some degree, not sure how much, an underreporting of the number of cases. Since, the patient that is not getting tested would not be included in this for the most part.
Perhaps, but it's not nearly what it was.
Not what it was, right?
Yeah.
Great. All right. And Dr. Potter may have some more numbers for us.
I do, although we had talked about getting babesiosis numbers, and I could not, the numbers are small enough it was hard enough to pull that out. I think there was 1 or 2 cases I treated last year and the year before.
Right.
All of those probably involve diagnoses after the fact without an office visit in response to blood work. So I haven't parsed out exactly how to pull that data, but
Yeah, that's, that's not as important as us. We're getting just a relative number of what's going on, and see, is there anything we can do about it?
relative being the operative.
Exactly, 100%.
So I'll share some of what I have, which is very basic and not official, I should clarify. And Scott, I'm sorry I didn't have a chance to email this to you ahead of time. So this is data from our office, our Meeting House Lane Medical Practice Office on Shelter Island. We opened the office in 2020. I excluded 2020 because that was only a half year. And for interest's sake, what I'm including, and this is not all cases that I've seen by any chance, because this doesn't include tests that were done that then we called the patient after the fact. These were in-person encounters that had a diagnosis associated with them. And for curiosity's sake, I looked at tick bite encounters versus definitive Lyme, erythema migrans, et cetera, encounters. And what complicates the data a little bit too is that, we're a new office on the island. And so the number of patients I saw has been increasing each year, right? As we have new patients coming in. So my biggest caution with this data, obviously, is that I think there are a lot of caveats around it. But in 21, we had 67 separate visits. I excluded people coming back for the same person or the same follow-up kind of visit, or tick bites, and 15 definitive diagnoses or of Lyme disease. As Scott was talking about, that probably includes both serological diagnoses, so people who had positive blood work, as well as people who came in with a case of erythema migrans with the rash that's very consistent with it. 2022, those numbers were almost flat, which I thought was very interesting. I think that doesn't necessarily represent that incidence was entirely flat. My denominator is probably higher, right? In 2022, I had more patients that year than the year
So
before.
relatively speaking, there was probably less.
So relatively speaking, there may have been less. Again, as we talked about before, the number of people we had on the island, we saw some really interesting shifts, right? 2020, 2021, 2022. So
Right.
that data is always going to be not necessarily an outlier, but have an asterisk on it for me, just because it's outliers.
And for those that don't know, he's talking probably about COVID, the increased number of people on the island and stuff like that. So it's interesting.
And then 23, there is an increase. The other really interesting thing here is about roughly a 30% increase in the number of visits I had for tick bites, and roughly a 30% increase, 33% increase, a little more in the number of diagnoses of Lyme. Now, the best question there, does that mean that in 22 to 23, we saw about that level of increase? No, I think it's important to remember, I don't see all the patients on Shelter Island. There are people who, of course, see Dr. Kelp. There are people who go off island for their primary care. There are people who go to urgent care. These are just trends that I noticed. I'll be really interested to see next year what 2024 look like. But this is what I have right now.
Right. And that's with everything, including the doxycycline, as we've said since the get-go. These aren't absolute numbers, or nor are they trying to define how many people on Shelter Island had Lyme, but it gives us a basis to look at something that's related to ticks and maybe deer, and we can go on from there to see if we can do anything about it. So if numbers continue to go up, we just have to seriously sit down and say, can we do anything? Or maybe we can't. Maybe education is going to be the only thing we can do, and that's going to work. So anyhow, these are good numbers, and they're real numbers now for us. First time we're actually dealing with real numbers for Lyme disease on Shelter Island. Not that Suffolk County is kind of, and it's interesting, the numbers are, getting closer to what they were. If you looked at the old days, Lyme disease in Shelter Island was 2 and 3 and 4 cases, which was obviously not, not right. Okay. Well, that's great, Josh. I appreciate that. Any questions for Dr. Potter regarding this? And this is just the beginning of more data. They're only data points. We'll be following them over the years and seeing if there's anything we can, impact on this case, because that's the real reason we're here. See if we can cut down the incidence of disease.
Is it possible to can somebody drop a copy of that in my mailbox there, or a folder or something? Or scan it to me, maybe, take a picture of it?
Sure.
Do any of the above.
Any of the above. We'll get there.
We'll get it to you.
Okay. Okay. Next on the agenda, and I think probably the last, let me just see, is just our mission statement. And we went around that, we discussed it a couple meetings. And that the mission statement went out in its final form or question, probable final form, the other day. I hope everybody had a chance to see it. I would read it to you, but as you know, my eyes are failing me, so I can't read well enough to do it justice. Anybody have any questions about it?
You want me to read it?
If you want to, if you could, that would be great.
Mission statement: to advise the Shelter Island Town Board and measures deemed socially acceptable, environmentally sound, and fiscally responsible in managing, monitoring, and maintaining the deer and tick populations as low as possible in an effort to decrease the risk and incidence of tick-borne diseases on Shelter Island.
Okay, that would be,
One question.
yes, sir.
Go ahead.
No, I would say that would be our recommendation unless anybody on the board, or not, excuse me, on this committee wants to change it. That would be our recommendation to the town board to change our mission statement to this one now.
I just have one thought that maybe you might have considered already and just missed it, which is medical best practices.
In what respect as far as for this committee?
Well, to advise the town board and the people of our community, what are the best medical best practices around ticks and bites we just.
We touch on that a little bit, but I don't think that is the actual charge of this committee, okay? Medical best practice is
It is a difficult.
it's a difficult thing to do, and it takes a lot of back and forth and big studies and a lot of peer review stuff for somebody to come down and say this is best practice. And I would be surprised, I mean, I'm sure it's out there now for Lyme disease, but that's something that the physician needs to be aware of and needs to deal with. And even they don't always deal with it. There's a lot of people say, okay, but that's not the charge of this committee. It can't be.
It's sort of addressed in there by proxy too, in the effort to reduce the risk of tick-borne disease, right? The committee puts out good information, connects the community with this, with the CDC recommendations, with, vetted information, and then tells people, certainly consider discussing this with your healthcare provider. So it's kind of in there by proxy.
Right.
It's included in all of the potential things that the committee does.
And the committee should, this is perfectly influenced, certainly influenced by my own bias as a primary care doctor, but the committee should, in my opinion, take no responsibility for giving medical advice.
I agree 100% on
That
that.
should go between individuals and their physicians, and any language that's even implying that is either something that people can look to the committee for or expect, I think is fraught with a number of problems, not least of which I think emphasizing, like Scott was saying earlier, and hopefully like we've done, these are what the general recommendations are. These are the guidelines from the various overseeing organizations. But ultimately, if you have a concern, you should, if they're a patient of mine or a patient of Dr. Keltz or whoever, you should reach out to them and discuss it on a case-by-case basis. Keeps that in a place where we're respecting that relationship and preventing, I think, a lot of problems and questions that could be.
And even when I was discussing the fact that what you tell a patient or a person when he has a tick on and what do I do? I don't want it coming from Dr. Potter or Scott or this committee. I want to see what the CDC, we need some, organization saying that this is our recommendation. That I can publish, but I don't want to put out Dr. Potter says to do this, or Dr. Scott Campbell says to do this, or the committee recommends that. We're overstepping our bounds if we do that. But if we can find that or direct them to the CDC website, direct them to the Southampton, hospital tick-borne disease site, that's legitimate. But that's where we stop.
Well, all good answers. The other thing is, can you give me a little more background, history on the socially acceptable aspect of this mission statement?
Yeah, well, it's, at least this is my thought, and I think I probably was going to start put that in there. Just one example, okay? What will the town accept as far as culling deer in the middle of the summer, okay? Culling deer in May and June where the females are pregnant. What will the town accept as far as bringing sharpshooters from off island? That's the thoughts that we have to, I'm not making a judgment on one or the other, okay? But that's what we would discuss, and we have discussed in the past, we have talked about culling deer, et cetera. So that's just one of the issues, so, you know, as much as,
Pesticides on public property.
Right.
Like, all kinds of just sort of community level, tolerances for things.
you know, hunting in general is not accepted everywhere or by everybody, a little bit more so now that we have this abundance of deer that maybe is causing some disease and eating their rhododendrons. But, you know, there are people that are still anti-hunters and, you know, we don't want to offend anybody if we can help it.
Thank you.
So if I can have a motion to approve this new mission statement from the committee members
Motion to approve.
and a second, and all those in favor?
Aye.
It's approved.
Aye.
If you could maybe send a letter with the new mission statement to Amber or to the board and just saying that's our recommendation, mission statement be adjusted or changed to this, that would be helpful. Thank you. Okay, anything else? Any old business, new business, anybody wants to discuss?
Oh, I have something, just a quick little fun thing. So a friend of mine called me and said, "Did you get your hunting guide yet?" And I said, "No, I didn't go down there." He's like, "Well, you got to get the copy." He said, "Because you're on the cover." I said, "It's a
Right.
doc." So the Hunters for Color, when we had that mentored weekend back in November, that became the cover of the hunting guide. It's kind of cool picture,
Nice.
Julie, you're making waves everywhere. It's wonderful.
maybe. Say.
Keep it up. All right, anything else? All right, motion to adjourn. Thank you.
Motion second,
Yeah.
all the above.
Yeah, it's all
I
good.
don't even wait for that anymore.
Thanks,
Josh, thank you very
everybody.
much for that.
No problem.
We'll see you next time.
All right.